Hey, Chris here from Better Exercise Physiology. In this video, what I wanted to run you through is give you an idea of how I treat pain and the advice I give to patients who are currently in a lot of pain. So at the clinic, I see a lot of low back and a lot of neck pain. So I'll give you a bit of an idea of what to do if you either lifted something funny or you turned the wrong way or you just woke up in a lot of pain. Now, the first thing to do is help settle that pain down. So for some people, that will include taking some anti-inflammatories. You will hopefully know whether or not you'll get benefit from anti-inflammatories or it may be other medications, and that's sort of always an individual thing, but that may be the initial step. After that would be releasing the muscles with some either myofascial release, and that can either be some self-massage, working into the area. You can use a foam roller, you can use a spiky ball, or if you're in a lot of pain, go to see a professional who will work on that for you. So it might be a massage, might be a chiropractor, it might be an osteo, someone who can release those tight muscles. First thing we got to do is get you out of pain as soon as possible, or at least settle that pain so it's just at a very low level. Once the pain has settled down a little bit, that's when we want to start looking at your range of movement. The major reason why pain continues past the first day or two, the major reason why it continues is because your muscles are still tight and they're not allowing proper movement at those joints. So next thing we want to do is increase range of movement at your joints. So my biggest recommendations, we're not stretching here. I don't want you to stretch the joints at this stage. I want you to go through range of movement exercises. So for your shoulders, if you've got shoulder or neck pain, it's some shoulder circles. For the upper back, it's some trunk rotations, and you can do these ones, or you can do a bow and arrow stretch. For your lower back, you'll be lying on your back and doing some knee rolls or some pelvic tilting. Gentle exercises, taking the joint through your comfortable range of movement. What that's going to do, it's going to loosen up the muscles, it's going to warm them up, and it's also going to decrease the sensitivity at the joints. You've just had a lot of pain there, your brain is really tuned into it, it's really oversensitive, so you're going to be a lot more heightened to any movement. This is going to help decrease that sensitivity. Now the third step, you should start to be feeling a little bit better. There still might be some pain there, but it's not that really heightened pain. You can move around without being in agony. The next step then is to start to strengthen up around the joint. So the reason you probably got the pain in the first place is because everything is weak, you've probably got some misalignment, you've got some tight muscles pulling your joints out of place. What we want to do is start to strengthen up some of those weak muscles. I'll typically use a lot of Pilates-based exercises in my rehab, or we run Pilates classes and I help people strengthen up through those. So the big areas, obviously your core muscles. We've got some outer muscles, we've also got our deeper core muscles. Your glutes are often, almost always weak and inactive. Your lower rhomboids, your lower traps at the back of the shoulders, we want to strengthen them up. So we work on creating a little bit more balance at your joint. So those are my 3 steps to take you from the point where you're getting a lot of injury all the way back to the point where you're moving and functioning like your body is designed to. Now, if you want more information or advice, go check out our webpage. It's betterexercise.com.au. You can find out everything there. Thanks a lot.